Hi, Dr. Pelto here. Want to talk today about this problem right here. See this little thing on the bottom of the foot? I know it doesn't seem bad, but it hurts people a lot. It's like painful, like walking on a tiny pebble. It's called a porokeratoma. So let's get into this. I'll tell you a little bit about porokeratomas. These are examples of porokeratomas. These are some of my patients that have come into the office. You can see here, this little dot here, little dot here, dot here, dot here, these two dots in this dot. So the first thing you have to check is this, so what is a porokeratoma? This is what we call a porokeratoma. I don't know if it's the best word, but this is what we use. Poro comes from pore, like a sweat gland, and then a keratoma is a hardened piece of skin on your foot. And these can happen in different areas. Where I tend to find them is under bony prominences. So you can see here, there's a bone right here. This is called the second metatarsal head, around the second metatarsal head, around the big toe, first metatarsal head, second metatarsal head. This is one that's on the side of the foot, which is not a weight-bearing surface, but usually they're under weight-bearing surfaces. How do we treat these? Well, I trim off the top, and then I cut out that piece of corn that's in there. And then I put on a salicylic acid with a Band-Aid and a little, I call it, it's a pad with a hole in it. And I leave it on there for a day, and that'll slough off some more of the skin. If it keeps coming back, then we can trim it out again. Sometimes we need to do an orthotic to offload that area where it's hurting. And there are some more kind of advanced treatments for porokeratomas, but it's a pebble. It's like you're walking on a pebble. It's painful. I have patients that come in at least every other week for something like this. I trim it down. Maybe I'll do it once or twice, and then they're fine. But other people that have it chronically, they have to either do an orthotic, and sometimes a really severe thing is you can lift up the bone. So basically you can take the bone and you do a little cut and lift that bone to go up a little bit. That's kind of beyond the scope of this video, but this is what's called a porokeratoma. So if you feel like you're walking on a pebble and it hurts, you should get it checked out. You should go see someone. Don't do this at home. I do have some people that buy razor blades and try to trim their own. Just be careful, especially if you're diabetic. You really shouldn't be doing this. And those little files, those little file things for the skin, those don't work that well either. Do creams work? Some creams work. A 40% or greater urea cream can slough off some of that skin. These acid creams, they also can make it feel a little bit better. But what I find is really you need a razor blade to trim this off and get it out of there. It's not going to go away on its own. I would get it checked out. I'm going to put another video here that I have on porokeratoma if you want to have a deeper dive on it. And if you have any questions, please type them underneath here in the discussion. I will try to answer any other questions that people have about porokeratomas or any other issues. So once again, I hope you guys found this helpful. Okay, until next time.